let's just leave it. Okay, so an update from me. It's been a long time since I've been on social media appearing or sharing anything new. I've just been kind of doing the back end business stuff and really just like focusing on my family and my health and my life. And I've been growing this big old belly. So that's kind of why I wanted to come on and do more of a belly massage. I've been asked a lot about belly massages lately. Obviously I've been doing that because that's just what I do. Okay, so that's the update on my life. I would love to hear an update on yours. I don't know why it's not gonna let me probably read your comments, but if you want to afterward, you can just write a comment on our postpartum group page or email me. Let me know what's going on, how things are going with you. Have you been working on the guide? I'm so excited to start the guide again. I'm like just so incredibly big. I'm only like a week or two out from, well, it could happen any day, but I go long, so it could be another couple of weeks and just go the full 42. Anywho, okay, let's start with massage. So you've seen me share about this on Instagram. This is jojoba oil, jojoba, whatever you want to call it. I say jojoba because that's just the kind of gal I am. And I get this from Mountain Rose Herbs. I buy it in like the bigger bottles and I just stick a little pump on top because it's just easy. And I use this, like people can use tallow, you can use lotion. I really try to use the cleanest ingredients of anything that I put directly on my skin because it's gonna get absorbed. And then the baby gets it through the placenta, through my blood. And they say that like babies have a lot of toxins in their system when they come out. So I'm like, oh great, cool. So I try to just get some pure stuff. So jojoba oil works really well because it spreads so nicely. So I'm gonna tuck this up for you. Whoop, don't mean to show you the under boob. I just kind of want to show you the rib cage because we'll kind of be getting at all of that. So I'm gonna step back a little bit. Look at that big thing. That's a big baby. It's not two, it's just one. So in case you were wondering, like everybody else tends to, you know. Did you ever get that when you were pregnant and people were asking you like, are you sure it's not twins? You're like, of course I'm wondering that myself. Especially as how sick I was early on. I was like, just double check. Let's just make sure that there's only the one in there. Anyway, okay, so I have the jojoba oil I just showed you. Clean Mountain Rose Herbs. I like it. Tallow. This is Texas Tallow. It's a small woman-owned company in Texas, and they do an amazing job. Their quality is incredible. It's very, very, very little for a lot of money, and it's great. So you could just buy tallow. You could buy plain beef tallow if you like animal-based moisturizers. Shea butter. I buy this. It's plant therapy. It's organic. I just buy this off of Amazon, and it's pretty inexpensive. It's like $10 maybe for a whole thing, and this lasts forever. It's thick. So I will mix this with the jojoba oil, and then that's like what I use for my lotion all over my body because it gets a little creamier. Yeah, I'm like, I could literally like a glazed donut, but I could just slide off the bed once I get that done. So it's kind of one of those things where you got to put it on early in the evening if you don't want to get your sheets all blech. So when I do the belly massages, I start with like, you know, just going on the skin layers because you got so many of those. And if you're postpartum, if you're, you know, years out, it's all still really good. You still have all those skin layers. You still have all those muscle layers. You still have your womb, your ligaments, your uterine ligaments that some of them you can reach, some of them you can't. And it's good just to give yourself all of that love and attention. So that's why I think it's so important. And because I think a lot of us feel dissatisfied with this part of our body before, during, after pregnancy. I just think it's really important to connect with yourself here through touch, because even if you're not happy in your mind with how this looks, just that act of care becomes love. So, you know, if you don't have it in your mind to be like, I really want to like look at my belly and massage it today, just do it. Just do it for the sake of, I know this is good for my skin. I know this is good for my body. And then it becomes an act of love. And then you begin to accept your body and love it more, and then make the changes you want to make when you're ready. So I do the skin layers. So that's like just, I rub, you can start really soft. You can start with lymphatic strokes, which, you know, everybody's into the dry brushing. That's fine. Start down low because all the lymph comes up from your legs and it comes right through this area, which is your iliac crest. This is your inguinal, it's like where your leg meets your belly. And that's where all the lymph has to come through here. And we, pregnant women, postpartum women, are very tight here. So it gets a lot of cramps. So we can stop a lot of lymphatic flow just in this area. So I like to really make sure I'm kind of opening that up. It can be light little strokes with your fingers. It can be with the dry brush, bringing it up, bringing it in towards the midline of your body. Okay, and then the skin layers, you know, you can just push a little bit more firmly through. And then you've seen me do the skin rolling, which takes all of the skin layers and your under adipose tissue, and it really just pulls it away from the fascia beneath. So you got all your layers of skin and adipose. Adipose is fat. So it's the fat that lays right underneath of your skin, which we all know, right? Like back here, you got a lot of it. In the front, maybe not so much. Definitely not that much up here. So you're gonna have different thicknesses to kind of work with, but pulling it away from that fascia beneath is so helpful and healthy because we tend to hold a lot more fluid pregnancy, postpartum as well. And that fluid can just stay stagnant in those areas. It can also lead to adhesions, especially because we're not like getting a lot of mobility through here. I mean, you can tell, right? I'm not rotating a lot. It's not getting a lot of action. It's kind of like a block, and then I'm waddling. So getting your hands in there to separate those out manually can really be beneficial. Get some health back in some of those tissues that have been neglected for a little while. So I like the skin rolling. You're not gonna see me do it over my big pregnant belly because that's just gonna hurt me. So I don't even know if I can grab it if I wanted to. Here we go. No. So I would do it up and around, do it up and around my love handles, through my back. That's really thick and it kind of hurts. So I have Drew do that because he's got stronger hands. So have your partner do that. Have your husband do that, your friend, your mom, whoever is around you to do that for you. And you can go up and down. Your lumbar spine is really good to kind of pull away. So skin rolling. Gosh, I wish I could see questions from you guys. I'm sorry, I don't know how to do this. I'll figure it out and we'll be better next time. I'm just gonna keep rolling on. So then I do really big sweeping strokes. And because, like I just mentioned, like these are my ribs. You can't really see them very well. I do big sweeping strokes from my ribs. The space between your ribs is your intercostals, and there's a lot of muscles in there, and there's a lot of fascia. And because we know the abs go from here down to your pubic bone, and they're being pulled apart right now, we know that they're tighter over here than they are in the front, right? They're being stretched to the max and separated. So that's why you can see like a little discoloration around my belly button. There's stretch marks here, of course, but there's also like discoloration. It's because the abs are separated. So you can kind of see that coloration from my viscera, you know, from my gut beneath of it, and just different vessels and stuff. So anyway, the abs over here are going to be a lot tighter, and these are like where your transverse abs come from. Those are the ones that come from your back all the way around. It's where your internal and your external obliques come from. So I just love to just get my hands in here and really sweep those forward because they're pulled so tight over here. So I bring them forward and I get a really good contact and kind of pull them forward. And then I can get in through, ooh, that's sore. Get in through my ribs in those intercostal spaces with my fingers, and you'll find like random sore spots where you're like, I had no idea that was a little fiery ball, and just kind of hang out on it. You can bring them all the way down. That's not going to hurt your ribs to get in between them and really massage those muscles. It's going to help your breathing. And then you guys know, because you have the guide, that there's like that laying over the side one. There's the rotating one, laying on your side, you know. This is like week 1 stuff. This is early stuff. Another good one, I think I've shown, is you can like reach up over a doorway, if you can reach a doorway, and let that hip drop and breathe into that side. So this side's short. Breathe into this side. So you've just massaged it open, and then you're gonna breathe into it to kind of stretch yourself from the inside out. Here, doing it on the other side. The right side of your body tends to be tighter through here than your left side. That's just how we're made. It's the asymmetry present in our bodies, which is incredibly cool, but also hard to understand because we like to think that we have to do everything equally on both sides when our body doesn't need that necessarily equally on both sides. So that's why in the guide, there's certain things you do for your left, certain things you do for your right. Your xiphoid, where your abs attach, can be very, very sensitive. It can be that it's your abs. It can also be that it's where your stomach meets your esophagus and where your diaphragm goes on it. So I just like to gently pull down there as well with my breathing. Inhale, get a good grip of it. Exhale, kind of wiggle that down. That helps me with reflux. That helps me with, I just get tender right up in there because everything's right now. So let's see, what else did we do? Okay. I think I've covered all of the massage techniques here. You have multiple ligaments for your uterus, you know, the ones in the front that we always remember learning about, your round ligaments. If you're postpartum, your uterus will shrink back down, right? And it goes back down where it should. However, that doesn't mean that we need to be stopping giving that uterus some love and some massage. So we can do that visceral massage. Visceral means actually getting in and kind of working around our organs a little bit at just a deeper level than just like skin rubbing our belly. And that can be really helpful with getting your uterus in a nice position in relationship to your gut, because gut issues postpartum and with stress, which is what we all of us moms know when we have children. And I mean, God, they're the best blessing ever. God bless them. But postpartum, thyroid issues, gut issues, hormonal imbalances, all of that stuff can be in relation to this womb adhesion-y kind of stuff. So I just like to always make sure that, okay, I'm not just done giving myself belly massage because there's no longer a baby in here that I'm connecting with. My womb needs to continue to move well. Oh gosh, baby's moving around. My womb needs to continue to have good blood flow, not get adhesed when it shrinks into wherever it should lie. And that's why movement is so important. That's why the postpartum movement guide is so important, because you're getting that breath, your breath is moving you huge. Your pelvis is moving that womb, that uterus around as well. But just getting in manually can also be done. So if you guys are interested, if you liked this and you want to go further with it, I have a lot of visceral techniques for digestion, for gut health, getting in there like the ileocecal valve, getting in around your uterus more, some of those ligaments, and then like just helping out with digestion for constipation issues, for IBS issues, all of the things that accompany hormonal changes and thyroid changes postpartum. That can be a part of your postpartum journey. I hope it's not, but it was a part of mine, and I know it's a part of a lot of women without us even, like, unbeknownst to us, right? And then we can also talk about baby and infant massage techniques as well, child massage, other stuff like that. If you like this series, if this is something that you'd like, and we could do, it's 15 minutes, you know? I mean, when did everybody join? Kind of at like minute 5 even. So it could be 10 minutes. I just want to do something special because you are someone who's purchased the guide. I want to continue to just have this relationship with y'all instead of just, you know, with anybody on Instagram. So I am trying to work on a strength training program, which has been in the works for a while. I've just been like really preoccupied, you know. God bless the blessings, but you know, you can't do it all. So if you have like any specific things you're like, I really want to see more of this, I really would like to see a baby infant massage, or yes, let's keep doing more of these, I can meet Tuesdays for 10 minutes and learn or work with you, let me know. Put a comment in the guide or in the group, or email me. I'm always available on email. That's like the best way to get a hold of me, because I'm not present on Instagram, as y'all know, and not really present in the DMs because they're just madness. So I like YouTube. I'm liking this YouTube thing. It worked. It was easy. Facebook was giving me a run for my money.